We're talking about this virus that is getting a lot of play in the news. It's starting to get people concerned. What is it called? It's called the Enterovirus. It's the D68.
Enterovirus D68.
It's scary just sounding like that.
Yeah,
but
it's like a long name.
What is it? What are we looking at here?
So Enterovirus D68 is part of a group of viruses called the non-polio enteroviruses. And this is a large group of viruses, and they are responsible, many of them are responsible for what we call the common cold.
Okay.
So, you know, runny nose, stuffy nose, fever, cough, sneezing, all those symptoms that we usually get with the common cold. Now, the non-polio enteroviruses are very common. The CDC reports 10 to 15 million cases each year.
Why are we worried about this one then? Why is it giving us parents fits and starts when we see viz like this? Kids in hospitals.
Right, so what we've noticed with this Enterovirus D68 is that since August, children have been admitted to the ICU and have had severe respiratory difficulties. So usually with enteroviruses, people just get a mild cold, they're done. But this is affecting young people under the age of 16, and especially young people who have a history of asthma and wheezing difficulties. Now, most people who have this Enterovirus D68 are still going to have mild symptoms or just the symptoms of a common cold. But if you have a history of breathing difficulties, if you have asthma, history of wheezing, then you need to be extra careful, extra watchful if you do catch a respiratory illness.
What are we watching for?
So difficulty breathing, so wheezing, loud breathing, noisy breathing, if they look like they're really working to breathe, if your child has nasal flaring, if the muscles are really working to breathe, if they're turning a little bit blue around their lips.
Straight to the hospital.
Yeah. Well, if it's just starting, it depends on the stage, right?
Yep.
Like if they just have a little bit of wheezing, it's just starting off, then maybe you can bring them to the doctor. But obviously, if it's serious, then hospital or call 911.
Err on the side of caution. Now, obviously, kids going back to school, hopefully, next week. This is not a reason to keep your kid home from school.
Not if they're not sick.
Not if they're not sick.
Yes. If they're sick, then you want to keep them at home and keep a close eye on them. And also because, you know, even if they have a mild illness, you don't want to spread the illness around and affect susceptible children.
You can help us out here in a big way. I know with my 7-year-old, if he's got a little bit of a runny nose, he's still going to school. What level of symptom am I looking for to say, okay, you're staying home? Fever, cough, or is it the runny nose? Should I be keeping him home?
Yeah, you know what? If they're sick, you should probably be keeping them home at this point. The thing is, a lot of these cases haven't actually had a fever.
Really?
Yeah, some of that has been noted.
So we should keep our kids home, erring on the side of caution even more so than we have in the past, because it seems like these kids have runny noses for a good 6 months to start school.
Yeah, well, I mean, if it's just, you can use your judgment, right? If it's just like a simple runny nose, they look completely fine, then, you know, maybe you can send them to school. But if they're sick, you'll know. Like, you're a mother, you know when they're
sick.
sick.
Dads know too, for sure. When they start to go, when they start to fade a little and stop eating very much and they don't really want to move around. How do we ward this off? Is it simple? Wash hands?
The usual precautions that you take with the cold. So wash your hands with soap and water for 20 seconds. Don't touch your face, eyes, nose, or mouth without unwashed hands. If you're sick, cough into your arm. Don't hug or kiss people who are not sick.
Germ blocker, that's what we call this. It's like the superhero move. It's a good one. But not touching your face is something that people forget about when they're...
Exactly.
Right?
Doorknobs, surfaces.
Wash them all down. Dr. Yvette Lu, we've also got a website that you can go to. It's a long one there, cdc.gov/non-polio enterovirus. And so it's something we should be concerned about, be cautious and cognitive of, but don't panic.
Yes, don't panic. Just be alert, be concerned. Watch for signs and symptoms, but, you know, just proceed with your normal life as usual.
Right. And if your kids are at all struggling with breath, do something about it right away. It is 8:17. Thank you for being here.